Good morning, everyone. I think Marian wanted to say something.
I did.
Okay.
I wanted to mention that on Thursday this week in the evening, NYC Fair has a town hall to tell you about and to discuss the budget. And we would love for you to participate. And if anybody needs the flyer, I can probably come up with it and put it in the chat. Just I could do that. All right.
I could do that for you, Marian, if you need help.
Okay. Thank you.
Okay, so I guess back to me, right? Good morning, everyone. Again, we have some updates today from OPWDD. I'm going to start with anti-stigma campaign, which is called Look Beyond My Developmental Disability. This campaign started last year, and our campaign continues. The campaign challenges us to all envision a future where people with developmental disabilities live full lives freed from past stigmas and stereotypes. This is a public awareness campaign, and we're using public forums, social and mass media, internet, radio, print advertising to educate the public about developmental disabilities and highlight the positive ways people with developmental disabilities can contribute to their state and their communities. Back in December, we started a paid media portion, and this will run through the mid of spring, and the paid media portion has already returned in more than 15 million impressions, 2 million video views, and over 40,000 clicks. So we are having some success, and we will continue to report on that. We have some updates for the proposed executive New York State budget. Governor Hochul again demonstrates her commitment to improving the overall quality, availability, and cost effectiveness of community-based, person-centered services for people with developmental disabilities by proposing to increase funding by 4.8% to nearly $5.1 billion. The governor's proposed budget aligns with our agency's strategic plan goals of strengthening the workforce, increasing opportunities for independence, and increasing access to services for people who are new to our service system. The budget also would provide nearly $47 million to provide a 1.5% COLA to increase reimbursement levels of OPWDD nonprofit providers. And this is the third consecutive year Governor Hochul's proposal provides a cost of living adjustment to service providers. This increase builds on the 5.4% increase in 2023 and 4% increase in 2024, for a cumulative increase of nearly $1 billion to OPWDD provider agency. The proposal also includes $79 million to recalculate provider reimbursement rates, and combined with the cost of living adjustment, this would provide an increase of more than $480 million for the provider network when fully implemented, providing fiscal relief to providers and allowing them to offer a more competitive wages to staff. The proposal is also seeking the investment of $45 million to support minimum wage increases, including indexing minimum wage to inflation rate. And the proposal also includes $1 million to fund targeted rate enhancements to Article 16 clinic and crisis services for individuals with developmental disabilities, known as CIDD services. Our budget is also would invest $60 million to new state resources to support OPWDD priority program reforms that allow people to receive the supports they need, including but not limited to people who are entering the system for the first time in seeking services, people who are receiving services but their needs have changed over the years. We are looking for increases to OPWDD housing subsidies that would actually will reflect fair market rent levels. We are looking for costs associated with people who have aged out of the educational programs and are in residential, in-state, or out-of-state schools, and we are looking to support those students to transition to New York State programs. The budget also includes reimbursement for new specialty hospital program that is slated to open later this year. We are also have costs will have updates to property and transportation costs in eligible Medicaid rates. As part of the proposed budget, $6.7 million would be included in the coming year and $20 million over the next 4 years to support New York State's commitment to become an employment first state for people with developmental disabilities. This funding would provide vocational trainings that help to prepare even more people with developmental disabilities to join our workforce. Governor's budget would create also has a proposal to create more opportunities for independence for people with developmental disabilities by investing $3 million to establish home enabling supports as an assistive technology service, which will give access to people to services, equipment, and supplies that are not paid through Medicaid, such as help pendants, call buttons, remote monitoring, or a two-way communication technology. $15 million is planned for expanding independent living opportunities for people with developmental disabilities. Since 2016, we have invested $125 million in capital resources to develop safe and accessible opportunities, and the governor's proposed budget would raise this investment to a total of $140 million as part of the state integrated supportive housing-ish program. The executive budget also includes legislation, Article 7 provision that would allow greater flexibility for the performance of certain nursing tasks by unlicensed employees of providers of certified by OPWDD in non-certified community-based settings. This would allow more individuals to remain in more independent settings and decreasing the reliance on certified residential settings in our system. Some other items that executive budget includes $1 million in annual funding to increase to Special Olympics New York SONY in fiscal year 2025. SONY not only provides inclusive sports training, skill building, and competition, but it also offers free health screenings and health education to individuals with intellectual and developmental disabilities. There are also several efficiencies that OPWDD can implement from the proposed executive budget, and most notably, it's reducing fees for CCO services by 4% for $5 million savings for OPWDD on an annual basis. That's it for the budget. I also would like to mention that earlier this month, OPWDD released new front door videos that are now available for viewing on OPWDD website. These videos outline the process of how a person can become eligible for OPWDD support services, the types of supports and services available, and how and where they can get the assistance. These short videos are broken into modules, they provide important steps in the process. And these modules include getting started with OPWDD, the front door process, eligibility, services, residential and housing supports, employment services, self-direction, care management, assessment, and funding. So these modules and videos are replacing the front door WebEx sessions. So we really encourage care managers and families to review those modules. Right now, they are available in English, Spanish, and plain in simplified Chinese, but we are also working on translating the modules into the other languages, and will come later this year. And while those translations are available, we are providing translation services for anyone who needs service in a different language. Okay. I also would like to mention our ombudsman program. The fiscal year 2024 budget last year included $2 million to establish an ombudsman program. This program will provide independent, conflict-free ombudsman services to assist people with developmental disabilities to preserve their rights. The main tenets of the program include the following: establish and oversee a statewide ombudsman network to identify, investigate, refer, and resolve complaints that are made on behalf of people with developmental disabilities. This program will provide appropriate support in resolving complaints, including but not limited educational services and rights, assistance of completing paperwork, health accident records. This program will also develop and implement a comprehensive community education and outreach plan designed to increase awareness and utilization of ombudsman services on behalf of people with developmental disabilities. And of course, we will be collecting NLP data. The request for proposal was made public through New York State contract report on Tuesday, February 6th, and we're anticipating a 5-year contract period that will start from July 2024 through March 2029, and proposals and applications are due to OPWDD by no later than March 11. And more information can be found on our website. I also would like quickly to mention that OPWDD transmitted April 1st, 2023, 4% COLA certification survey, and the survey is due back to OPWDD from providers by April 1st, 2024. We're still waiting for responses from some agencies. On February 6th, OPWDD hosted a WebEx introducing a couple initiatives that would provide additional funding to providers. And those initiatives were covering incentives for community transitions to less restrictive settings. This is for the individuals who are in residential schools, graduated, and we have a difficulty of finding the appropriate provider. We are giving the incentives to the agencies to transition those individuals. Also the same for the individuals who are in the hospital, were in the hospital from December 2023, and they have no placement to go. That's also, and individuals in the ITO. The second initiative was to support the cost of compliance, which is HCBS setting standards and installation of privacy door locks. And the third initiative was to provide one-time bonuses for direct service staff retentions. So this WebEx was recorded. It's available on the website, and it's a busy month for the providers because we're collecting attestations that I think some of the attestations for these initiatives are due this week. All right, and I think lastly, I would like to mention, to give an update for HCBS waiver renewal application. Last month, on January 24, we have submitted federal public notice to initiate 30-day public comment period on its draft renewal for a waiver. The public comment period will end on February 26. Actually, it's today. So today is the end of public comment period for the waiver application. The information for the public comment can be found on our OPWDD website, and this is consistent with CMS requirements to renew waiver authority every 5 years, and we are seeking the renewal that will go effective October 2024, through September 30th, 2029. This renewal is largely technical and an administrative exercise and doesn't include any significant programmatic changes. The most notable change included in the waiver renewal applications, those are projected HCBS waiver enrollment numbers and fiscal neutrality calculations. And based on recent utilization figures and trends, we are expecting the growth for OPWDD enrollees that will go from $104,000 for capturing 2024-2025 in 2024-2025 year enrollees to approximately 114,000 enrollees by the end of our 5-year renewal period, which will end in 2029. And this reflects roughly a 2% average annual growth rate, which is consistent with pre-COVID-19 activity. Additionally, a technical change was made to identify the need for 1915 authority to support the implementation of home enabling supports, which is a new service authorized on October 1st, 2023, and it will be included in our waiver amendment. 1915 authority will allow for a selective contracting approach to ensure statewide provider coverage over the new service consistent with service provisioning and ensure that the state and federal privacy requirements are met. The current OPWDD waiver covers a 5-year period from 1920 through 2024 and includes recent waiver amendments changes that were approved by CMS effective October 1st, 2023. So the OPWDD will submit the renewal application to CMS by April of this year. And if I have time, I can also quickly talk about employment support initiatives. Governor Hochul announced an executive order committing New York to being an employment-first state as it pertains to people with developmental disabilities, joining 32 other states with employment-first guiding principles in place. This will build on the governor's 2023 signing of executive order, which committed on making New York State a model of employer for people with developmental disabilities. And we have invested about $13 million in grants for career-specific vocational trainings, and these grants were awarded by OPWDD to 8 new projects statewide to fund career-specific vocational training opportunities for people with developmental disabilities. In last year, through a competitive procurement process, we awarded career-specific vocational training classes over the next 3 years. And people who complete the classes are fast-tracked to OPWDD training programs. And in New York City, we have NYSARC, who are offering janitorial and custodial career development programs to the participants. So I think that is it for me for today. Thank you.
Thank you, Nina. I have one question and then I'll see if anyone else has.
All
I already
right.
see a hand up, so there will be a couple of questions for you. Regarding the DAHAB, I guess we can call it a survey that we were requested to fill out regarding pre-COVID, post-COVID service usage. Is there a time frame on when results will come out and what the plan was based on those results?
I think we're still, the first phase we worked with the providers. The second phase we were working with the care managers, right? We were trying to assess, and I think this is still being evaluated, the capacity the capacities within our with our providers within the day program footprint. So this is still being evaluated.
Okay, thank you. Rochelle, you have a question?
Yes, thanks, Brian. Good morning, Nina, and
Good morning.
thanks so much for this extremely comprehensive report you gave us this morning. I have two questions, I guess. One is on the new videos for the Open Door
Yes, front door.
program. The front door, sorry, the front door program. I looked at them and, they seem very good and they have the benefit of being available in many languages and having uniform presentation. And I could see that it's a good initiative. What I wanted to share was that there are many families who've gone through this process who felt like one of the valuable things that might be lost with going to this video only format is that, when families are coming through the front door, they're very anxious. They don't know a lot. There's, my son went in before the whole front door thing, so I don't have personal experience of this, but I'm getting a lot of feedback from people. And that one of the things that benefited an in-person meeting was the opportunity to hear other people's questions, because sometimes you don't even know what to ask as a person new to the system. So I was just wondering if OPWDD has considered having maybe occasional, not monthly, but occasional meetings where people who may have more questions, and I know they can speak with someone at the DDRO, but this would give them an opportunity to hear what other parents' questions are, to, share some maybe mutual concerns. I might be of benefit to people who are really struggling in this new environment. So I would, you may not have an answer for me, I know. I just wanted to raise that as a fairly prevalent concern that I've been hearing. The other question I have is, in the waiver, you said that OPW is projecting a 2% growth rate. And that seems kind of low to me, given the, the very rapid rise, in particular for people on the autism spectrum, not to mention other, and, maybe it's offset some by other diagnoses going down, fortunately, but still it's a low projection, but that's my opinion. My question is, if it turns out that the number of people applying for services exceeds this 2% projection, what's the process? How does it get corrected? How does the budgeting get corrected, or the waiver?
So with our 2% projected increase rate is consistent with pre-COVID numbers. I don't have the history with a waiver, but this is consistent with the numbers that we had pre-COVID, the growth of waiver participants. What also happens is that we have many people who are enrolled in the services but not receiving the services on a regular basis, and this is how this is balanced out. I don't know.
Is there any process to modify it if the projection maybe needs to be raised? That was just one. Again, if you don't have the
You know,
answer.
right. We've done so many amendments and modifications previously, right? So I guess if the need will arise, this will be addressed in the future, in the years to come. And speaking about going back to front door sessions, this is something that I can raise to the leadership, and we can mention that to the central office about the maybe have this opportunity for WebEx, right, and to have this live meeting. But yeah, every family is what I'm trying to say. I guess every family situation is different, right? And once they connect with the front door, they will be. I believe they will be able to get all the answers that are specific to their needs.
Just one final point, Nina, and then I'll be quiet. But just to consider, part of the reason that people are enrolled in the waiver and perhaps not using their services is that there's a lack of availability of services in many types of service and in many areas because of the staffing issues, which I know OPW is very well aware of. So to project growth based on an underutilization due to the staffing crisis, to me also perhaps is problematic, but as long as there is a way to adjust it in the future, but I think that's reasonable. But, you know, the staffing crisis predated the pandemic and the underutilization predated the pandemic. It's just gotten so much worse since the pandemic.
Thank you.
Trudy, you have a question for Nina?
Hi, thank you, Nina, so much for the presentation. And I wanted to piggyback a little bit on what Rochelle was mentioning about the front door modules. I think the modules are in different languages. They provide very basic, basic information about what's front door and the services. What I've noticed is that when parents want to sign up for the front door session, the links are no longer available. I guess now is to watch the modules and contact via phone to OPWDD, and it kind of reminds me back in the days when every single parent had to make a phone call through front door. I have just to give you feedback about parents who watch the modules, and they still come back saying, okay, Ms. Trudy, what am I supposed to do next? And so I think there is a need to have more of an in-person explanation as to what is the next steps after I do front door. Yes, you gave me all this information, but to navigate the front door and get evaluations and get a care manager and CCO, and all of that. And I know every family cases is the same, but I think there's got to be, more of a streamlined information as to what is the process of front door. I feel we're going back to the beginning where everybody had to call a phone number.
Thank you.
Nina,
Thank you, Trudy, for your feedback.
I was just going to say, if I may, Hello, everyone. My name is Lucille Mazie, and I'm the Regional Field Office Administrator for the Brooklyn office, as well as I used to be the front door lead for Region 4. So to your point, even when we had in-person front door sessions and parents will come to the front door sessions, before services are authorized, they're supposed to be speaking to the front door facilitators. And what we found was that the front door facilitators would still have to review most of the things that were presented at the front door information sessions. And they would still kind of like go over like the information and clarify. And parents have opportunities to be able to ask, because at that point is a one-on-one. One of the reasons behind this videos is because, it's broken down into models. And so a parent can go at a time, and kind of watch the one that relates to them. even after they've spoken to a front door facilitator, they don't have to watch everything at one time, because I can imagine that that would be very overwhelming and it would be a lot of information. But if they go to the one that's relevant, if they're, if they have children that are transitioning into adult services, they can look at the one that has to do with employment services. If they're coming brand new, they can look at how to get started with OPWDD, as well as look at the one that has to do with eligibility. And it's also convenient for them. They can look at, they can go at any time, at their own convenience. We found that, the front door in person, even though, to the point that was made earlier on, it was very helpful because, we got feedback, from parents that said that, just hearing other parents talk about their own experiences and ask questions, it was very enlightening and very illuminating for them. So that's a very good point. And as Nina said, we definitely will take that back, to see what can be done. Also, I believe that, family members can leave reviews now with the front door. After watching the videos, I believe, they can give feedback. And our central office has been tracking those feedback. And so far, most of the feedback that we're getting are very positive, but we definitely would take this back. So to go back, just to summarize, the families will also have opportunities to talk one-on-one, with the front door facilitators at the time that those services are being discussed. Yeah.
Thank you, Lucy.
You're welcome.
Thank you.
Thank you. We have another question from Paula.
It's really also piggybacking. I think this is important for us as a group to suggest based on experience. I see both sides of, and I do a lot of trainings, and I know a lot of parents preferred, this model in terms of they don't have to go on all that, but we also have a group of parents that need a little bit more help. So what I'm probably suggesting is like a hybrid program. We don't have to eliminate one way to, we can, the modules are very, very important. And I think a lot of families will be able to go through it. But at the same time, given that this presents a lot of anxieties to families, we should have at least twice a month, a session in which, parents perhaps, and I have seen that in other organizations, they have like recurring meetings twice a month, and when people register for those meetings, said before you come to the meeting, make sure you watch the videos and all that, so come prepare already of what you really need to ask. So I think all that combined could improve the way that people understand this system, understand what is, provided, what they need. A checklist perhaps is always helpful. It's always helpful to parents to have like a checklist. Okay, 1, 2, 3, this is the process, and this is how I start, and this is how it's supposed to end. Something in those times, the more the merrier in terms of organizing the parents. That's probably another thing, organizing the parents, because this is very stressful. From the perspective of OPWDD, I know you making an effort to accommodate everyone, but from the perspective of the parent, this might be unique process for them, and brings a lot of anxieties and a lot of questions that they have should be answered in some kind of forum. So I would suggest hybrid might be a way to kind of take care of different set of parents. That's it.
I agree 100% with Paola. And at AHRC New York City, for example, I provide those type of workshops that Paola was mentioning, because a lot of parents don't even know what front door is to even get services in the first place. And they have no idea, okay, what do I go to OPWDD website? They don't even know about what OPWDD is. So a checklist and a hybrid, I totally agree 100%. At AHRC New York City, through Family Education Series, I provide those workshops on transition, because this is part of transition, and it's an ongoing process from school all the way through adulthood. So I think that hybrid model that Paola mentioned, I agree 100%. Thank you.
Thank you, Paula and Trudy.
Any final questions for Nina? All right, I don't see any. Thank you so much, Nina, for your report and for taking all the questions afterwards. And thank you, Lucy, for supporting her as well. All right, I don't believe we have Richard from IAC. I think there was some last minute conflict. So then I'm just gonna move ahead, and is Nicole here from Pause? I think I saw her name.
Yeah, I'm here. Can you hear me?
Okay, so Nicole, the floor is yours. We can hear you.
All right, cool. Let me turn on my camera. All right, hello. Thank you for having me. So yeah, I'm the president and founder of Autistic Adults NYC. We are an autistic run nonprofit. We do like a variety of different social events, educational stuff, creative events for the autistic community. A little bit of history on like our organization. We started doing meetups for autistic adults in July of 2022. Initially just like social outings, so going to parks, museum visits, game nights, and we pretty rapidly started growing. We could see there was like definitely a need for some sense of community and connection, especially after the pandemic. And now I think we have like a little under like 1,200 members. So as we started growing, more volunteers got involved. We started doing different types of events, and we incorporated as a nonprofit July of 23, so last year. So yeah, we're not like a clinical program. We don't really do a lot of like support group type of events. We're really just a social club. We focus a lot on community building, self-advocacy, sometimes networking, and we try to like foster like connections and relationships between people. So as we've grown, we've realized like a need for different types of events and different programs, something that, you know, I'm sure all of you know about autistic people. We are not a monolith. There's many different like personality types within our community. Different people are going to enjoy different types of events or feel comfortable at different types of events. There's a like ton of different levels of like sensory needs within our group. Some folks fall a lot more towards like the sensory seeking side. Some get really overstimulated with different types of environments. So we try to have like a variety of different events to suit like different types of folks. So yesterday we did like ice skating, which was pretty fun. We also have like a lot of like more quiet, calm events, like a lot of arts and crafts stuff. We do like bi-monthly plant walks, plant ID walks, where we go around local parks in the city. And we one of our volunteers has a special interest in like horticulture. I think she studied it as well. And so she'll like go around and ID different plants and tell you like what might be edible, what's a native plant, what's invasive, stuff like that. So that's been pretty fun. There's also like a variety of different like communication types in the group. Some like from people who are like not speaking to people who are extremely talkative, and a lot of in between. So we want to create spaces where folks feel like they can really connect with others in the way that they feel comfortable. So our general monthly schedule, we do about like 10 to 15 events per month, some online, mostly in person. We try to spread them around the city. Mostly we do events within Manhattan and Brooklyn. Majority are social events. So like I said, we've been doing plant walks. Well, we stopped during the winter, but we're starting again next month. We do like a lot of museum visits. We also do like creative classes at Pier 57 in Chelsea. So we've been doing like the creative based stuff. So doll making, special interest presentations, or educational stuff on like careers, independent living, and then a lot of art classes. But a new program we're starting is called Pause, for Proud Autistics Unmasked Social Exchange. And we created this space specifically for non-speaking, intellectually disabled, and high support needs autistic adults. Again, to try to create programming that folks can feel more comfortable to be themselves in and hopefully connect with others. There are a couple distinctions between like our Pause program and like our general events. Is that first thing is that these events are typically more like free flow and less restrictive. We do have like a set activity, but folks are really able to jump in at any time. There's no like strict instruction following, and we try to keep the activities pretty simple and straightforward. So I think the beginning of this month, we did like a build your own sensory kit event. So we brought in like these cardboard boxes and we had a ton of like different sensory items set up. So like poppets, Play-Doh, fabric, just like a ton of stuff. We had markers, stickers, ton of stuff. And people were able to decorate their own box and fill it with different items. So yeah, some people went really into decorating. Some just kind of slapped some stickers on, called it a day. Some wanted to play with the poppets the whole time. Like, again, we try to create like least amount of pressure as possible. So, you know, people don't need to follow things to a T. They can maybe find the one aspect of the activity that they're most interested in, focus on that. And you know, if people want to just kind of like relax or walk around or do whatever, that's cool as well. Also, unlike our general events, these are open to friends and family or aides who want to attend. Our general events, we do try to keep them like autistic only environment, as most people in the group kind of prefer that and need that like safe space to feel that like sense of community. Unless someone needs like an aide or an interpreter there, which, you know, they can let us know that in advance. But the pause events are, you know, open to all. It's definitely less restrictive, more relaxed. And with the pause events and with all of our events, we don't push for any type of communication or ask that folks follow instructions in a specific way. Like I mentioned, this isn't like a clinical program or a support group or a group to like work on social skills. We encourage people to use AAC or walk around and explore or stay as long or as little as they feel comfortable. Right now we're trying to do the pause events once a month, but we hope to increase as, you know, we have more folks interested in signing up for events. So our next event is this Saturday at the Brooklyn Public Library, the Brooklyn Heights branch. And I will send the link to RSVP. I think I already saw Laura send it. Thank you, Laura. But I'm gonna send it again with our website and here it is. Our website and our general like program page for pause. So you know, if you're interested in sharing with the communities, or if you just want to check out our website. And for pause and our general events, you know, they're open to anyone, so it's up to the individual to choose like what program or event they want to come to. But like I mentioned, pause is the only one that's like open to friends and family and aides and everything. And yeah, people can sign up for whatever event they want to attend. Our general events do fill up pretty fast because we have like a lot of people. But you know, if you're like like subscribe to like our meetup page, you get a notification when they are posted. All right, that's pretty much all I have. I'm open if anyone has any questions, but again, thank you for having me.
Thank you so much for joining us, Nicole. I know I had met with Sarah a couple months ago, and that's when I first heard about Autistic Adults New York City and Pause, and we had started sharing your information. So I just saw you shared your website. So there is, for anyone that's interested, a way to subscribe to the newsletter. They have a great calendar that's easy to maneuver and get through on their website. And as long as it's okay with you, Nicole, when events come out, I did sign up for the newsletter. I can forward it to the Brooklyn Council mailing list, so that way people are aware as well.
Yeah, that'd be great.
Just to get more access and notification of your events.
Totally, yeah, thank you.
And I see you guys are also on Instagram, so anyone that's interested, you guys can follow them there. Does anyone have any questions for Nicole? All right, I don't see any. Thank you again so much, Nicole.
Yeah, thank you.
Next we have Sueann and William from Department of Health. Oh wait, oh no, that's not a hand, that's a clap.
Good morning, Brian. Hi, thank you so much. And thank you all for allowing me to be here today. It will just be me by myself. Will just actually came back after being away, so he's catching up. Before I share my screen, I just wanted to introduce myself. My name is Sueann Jardine. I'm an infection prevention and control evaluator with the New York City Department of Health. Some of you may remember me. I presented with Will Greendyke 2 years ago during the fall of 2022 on the project that I'm about to talk about shortly. So let me just share my screen. Sorry, just bear with me. second. I usually work in teams, so now I've gotten used to that. I'm not able to share.
Give me 1 second. I'm making you co-host.
No problem. Thank you so much. Sorry, I should have asked beforehand.
You should be good now.
Okay. All right. Share. Let's see. Can everyone see my screen?
Yes, we can.
Oh, perfect. Okay. So now I just got to get mode. Okay. All right. So I'm just gonna minimize this right here and stop my video for a second. Okay. So today I'm going to be discussing the infection prevention and control, which I'll also just use the acronym IPC, needs assessment for staff of group homes for individuals with intellectual and developmental disabilities in New York City. Okay. My slides aren't advancing. Okay, there we go. So first, I'm going to just do a brief project overview, which might be a recap for some of you if you remember the project. And then I'm going to discuss a little bit about survey methods for both the survey and the listening sessions, as well as the survey results and the listening and some of the listening session results. So this project was born out of a CDC, Centers for Disease Control initiative that whose aim was to inform infection prevention and control, capacity building, resource development, and support. The target population for this specific project were the staff of group homes at IDD facilities in New York City. Our approach was to connect with all 87 organizations, and we were looking to conduct a web-based survey and also listening sessions to learn just more about infection prevention control practices at these facilities. So for the first phase of the project, we did a web-based survey. We targeted the leadership and managerial staff at the agencies, and we sent everyone a link who wanted to participate to a 50-question survey that asked questions around organization and staff background, current infection prevention and control practices, and current and preferred infection and prevention and control practices and needs. The survey was launched in February 2023 and was open for about 7 weeks. We received a total of 41 completed surveys, so almost a 50% response rate. And just to talk a little bit about the survey methods, we presented this project at multiple meetings in the fall of 2022. Fall and winter, we presented at all of the DD Council meetings, the IAC meeting. I think at that time, Tom, I'm forgetting his last name, was leading IAC. And then we worked with Winnie as well to help roll out the survey. And then we also presented to our OPWDD stakeholders as well. So as I mentioned, the survey was rolled out in February of 2023, and we did 3 rounds of emails, just reminder emails to get as much reach as possible in early March and then mid-March of 2023. So to discuss just a couple of limitations, initial emails were sent out by our partners, which was great. We needed the collaboration, but we didn't have the list that those emails went to. So we sent out reminder emails to sort of a catch-all list that we got from our internal team that works with a lot of the IDD stakeholders. And this is more of a reminder as I present the data. The target audience for the survey were leadership and managerial staff, but some of the questions asked about staff knowledge and attitudes towards IPC training and practices. So it's kind of a third view of these questions. So just something to keep in mind. And then during the second phase of the project, we did listening sessions, and we did these sessions with the frontline staff, mostly direct service professionals who work at these agencies. We conducted 4 sessions in July of 2023 and looking at similar areas, current infection prevention and control practices, as well as IPC practices and training needs. We had a lot of people respond that they wanted to participate in the listening sessions. I think it was actually may have it on the next slide, maybe about 30 something, but we only have nine people who participated. And I just wanted to point out that 7 of the 9 participants also worked at organizations that completed the phase 1 survey. So some of the questions we looked at, the areas that we looked at for the survey were staff characteristics, organization details, infection and prevention and control practices, such as barriers or facilitators or things that make it easier to do infection prevention and control, training, and then also we wanted to know about how people wanted to be supported by the New York City Department of Health, because it's very important for us to know. So I'm just going to go over a little bit of the results. As I said, it was 50 questions and we received 41 surveys. So there's a lot of data there. So I'm just taking some highlights. And at the end, if anyone has questions, I'll give you as much information as that I have. Data analysis is pretty much done for the project, and I do have everything up. So if you have questions, I'm happy to answer them. Okay, so the majority of survey respondents work in roles at leadership at their organization. So 49% were identified as either president, CEO, or executive director. 34% identified as either program director, program manager, program lead. And then we had 17% of the respondents who identified as clinical staff. Approximately 1/3 or 34% of survey respondents at the time we asked questions had only worked in their current role for 0 to 3 years. So a lot of folks started in their role during the pandemic, but the majority, 88% of respondents had worked with IDD populations for 11 or more years. So even though a lot of people just started in their role, they had many years of experience working with the IDD population. When looking at the agencies, nearly half of the organizations serve resident populations that require assistance with ADLs or activities of daily living, and IADLs, instrumental activities of daily living. So we know that IADLs are a little bit more complex. And the reason we ask this question is because, infection prevention control is its own set of responsibilities. So if people are working at an agency where residents have a little bit more needs, so maybe there's a less time for doing stuff like infection prevention and control. And so those are things to keep in mind. We put this statement in the survey, and I'm just going to read it. Staff in my organization understand why it is important to use personal protective equipment correctly to prevent the spread of the disease. 56% of respondents strongly agreed with the statement, 20% strongly disagreed, and 24% agreed. When we talked about facilitators of PPE use, so these are things that make it easier to use PPE. Respondents, 14 of the 25 people who responded to these questions mentioned access, so accessibility, availability, and procurement procedures. So I should have mentioned this in the beginning. On the left are the summary breakdown of the number of people who responded, and on the right I have just a few quotes to demonstrate what we were looking at when we analyzed this data. So in terms of accessibility and availability, one participant said, the QA department ensures that there is always a backup supply as well as delivery of any needed PPE if any program cannot for any reason get PPE stock. Another facilitator were financial factors and staff cooperation. So 8 of the 25 people who responded to this question mentioned partnerships, donations, and staff cooperation. So I'm reading the quote on the right. New York City and IAC also facilitated access to PPE stock during the height of the pandemic. Other folks mentioned policies, guidelines, and managerial encouragement. So PPE must be used before entering a consumer room and remain in place for the duration of work. Okay. And then another just survey highlight, almost all or 98% of survey respondents know the appropriate staff members to contact if they have questions about IPC practices. So next, I'm going to get into data from the listening session guide. And as you might recall, these were the 4 sessions done in July, and these are done with the frontline staff, the staff who were, with the residents, and we had 9 participants in total. We asked about their background, their current infection control practices, training, preferred training, and we also wanted to know from them how they wanted the New York City Department of Health to support. So I just want to mention that the quotes I'm going to read in this section have been edited for readability, but they still capture the gist of what was said, okay? So what is needed for infection control? One of the things that came up multiple times in the conversation was having the right equipment. So 6 of the participants mentioned things such as gloves and cleaning solutions for the residents, the ability to clean up spills, and the proper equipment for training staff. So I'm going to read this quote here. This is from participant 4, the right products. Having the right equipment, the right cleaning. We're not allowed to use any bleach. We use disinfectant. So we have a spray disinfectant. And sometimes, like if I'm working in the med room, I'll use a hand sanitizer as well to clean the areas between our medicine cabinets and our knobs. What are some infection control challenges? We asked about challenges because this is important to know. One of the things that was noted was inconsistent communication. Actually, 4 participants mentioned this in the discussion. They mentioned that sometimes information doesn't filter down to frontline staff, and sometimes guidelines are difficult to explain. So the quote over here on the right is from participant 5, communication, better communication, make the information more available for us because we're the front line, we're the hands-on, and in order to make this work, we have to be better served. We have to be better organized. We have to be better trained. So yeah, communication, definitely better communication. When we asked about what strategies are used to address infection control challenges, one of the things that came up very often was sick time policy. So 5 participants mentioned the enforcing sick time policies and the ability to stay home when sick, and also using sick time without penalty helped to, address infection control. So reading the quote, and well, there are posters that say if you're sick, don't come home, don't come in. Some people do come in, and I tell them, excuse me, don't come in tomorrow. Please don't come in, go home. That's what I tell them. And if you're sick, stay home. Don't come in because you're going to make matters worse. The clients are up in age and their health systems, are low. When we talked about training, we asked staff what are some of their training preferences and specifically their training sources, where they want to receive training from. 8 of the 9 participants mentioned the New York City Department of Health, CDC or the Centers for Disease Control, their own IDD agency, or just having multiple agencies come in. So for the top quote on the top, all those places are great information. You see, the CDC is recognizable. Department of Health is recognizable. So when I hear CDC, the word CDC or Department of Health, I know that you mean business. I know that the information, is valuable and it has been studied and you have statistics to back it up. Another participant said, at one time there was a guideline that you guys follow, but then the state here didn't follow that guideline. I would prefer that training comes from the outside because I think it's more of a bigger platform. You guys cover more than the state that might just cover OPWDD or the Office of Mental Health. So that's just a little bit of what the data that we got from this project. In terms of next step, I'm working on a full report of both the survey and listening session data that will be comprehensive. I'm also working on a one-pager to share with, meetings in spaces such as this that doesn't go quite in depth, but gives you just an overview of, everything that came out of this project. I just want to say a huge thank you. And some of you may not have been around when we first launched this project in 2022, but this was a very heavy lift because we had to get a lot of buy-in and partnership, and people were so open to hearing from us, even if they had doubts about the actual rollout of the project, specifically when it came to doing the listening sessions with the direct support professionals because of things like, staffing shortages. People don't have, and that was actually one of the things we learned, is that a lot of people wanted to participate but did not have the time to. So huge thank you to everyone. Also want to thank all the IDD stakeholders. I know there's so much going on. So, and there were a lot of different surveys being rolled out around the same time. So we were doing it. So I don't want that to go unnoticed. And with that, I'm going to leave it open for questions. If anyone has questions or comments or suggestions, I'm here for all of it. I know that
Does
I said
anyone
a
have
lot.
any questions for Sueann? Well, it was a great presentation, very informative.
Thank you.
And I
Thank
appreciate you coming back and following up, because a lot of times people come with information and we never see the results. So that was helpful.
Yeah, it was really important for us to close the loop. And we actually presented at the quarterly meeting back in December, and 2 of our OPWDD stakeholders that gave us a green light with the project were there, and they were very happy to see that we're also coming back to present, because we took a lot of time to ask people for their time. So, I am going to send out, as I mentioned, a 1-pager once it's ready. I see that one person is raising their hand.
Yeah,
Yeah, Rochelle has a question.
yeah,
Hi,
thanks,
Rochelle.
Sueann. It's a very interesting presentation. This is a little off topic, but I was wondering, is the health department monitoring the incidence of COVID currently in the group home settings?
I don't know if we're monitoring it as closely, so I don't want to misspeak, but we still monitor COVID. We don't report out the way we used to, like during the pandemic. So I'm sure there's still some like baseline monitoring. It may not be on at the same level as it was during the height of pandemic and even coming out of it. But we, there's still, I don't have the website available, but I can, after the meeting, send it to you, Brian, where you can see statistics on COVID and that are pretty up to date if you have questions. Hi, I see another question. Doris? You're on mute though.
Doris, you're muted.
Right. Hi, good morning. I have a question for you. I wanted to know the results of the survey. Were you guys surprised by the results, or was it in line with what you were thinking? Because obviously you're aware of certain problems in certain areas. Was this like what you were expecting, or were you surprised by anything in the survey that, good, we had a survey because now we know this is, I was curious about that.
Yeah, I wouldn't say surprised. I felt like, well, the one thing, and I mentioned this during the presentation I saw, was that, that statement regarding staff knowing how to use PPE correctly, and 20% of the respondents disagreed. That's something that stuck out to me. But I was very, pleased to see how much people shared in terms of wanting support from the New York City Department of Health and how transparent people were. So if that anything, that's probably what it was. It's like, oh, people are really talking and saying what they feel. And having the 2 sets of data, because the survey was for leadership and the frontline staff were the people who did the listening session. It's really helpful. And like I said, I'm still doing the comprehensive report. They complement, the 2 sets of data complement each other, because, sometimes the people at the top don't always hear from the people who are doing the work. And so it's nice to put that together and see where there's agreement, and see where, like, especially communication, like, we receive guidelines, but they don't always trickle down the way we think they should. And so, I was just so grateful to like the listening session participants for being very open about that at a time where I think it was kind of like, a little touchy-feely with all of the fallout around COVID, all over. And I was just happy that they shared that. Yeah.
Thank you. Thank you.
Thank you. Thank you. Thank you so much. I saw your message, David. Thank you.
Any other questions for Sueann? All right, I don't see any at this time. You're more than welcome to stick around. If someone has one, they can throw it in the chat for you. But again, thank you so much for rejoining us and giving us the update, and looking forward to seeing what you guys do to support our field going forward.
Yes, absolutely. Thank you so much for having me, and thank you for your wonderful questions. And I'll definitely be in communication with you, Brian.
All right, take care. Thank you.
Thank you.
Okay, so next on our agenda, updates from the Brooklyn Council committees, if there are any, or if you want to plug your upcoming meetings. Go ahead, Debbie.
Good morning, everyone. The Provider Information Committee with Care Coordination had a presentation when we met on Wednesday, February 14th from 10 to 11 from ACA. They gave us a really good presentation, and we were very appreciative of their explanation of how they're making changes within their care managing organization. Our next meeting will be on Wednesday, March 13th from 10 to 11 on Ring Central. And we believe it will be, we're hoping to get Tri-County. So that's us. Thank you.
Thank you, Debbie. Any other Brooklyn Council committees want to give an update or plug their next meeting?
Good morning, everyone. It's Marjorie. Hope everyone is well and everyone has a great week. We have our next meeting on this Wednesday, February 28th at 10 a.m. So please join us if you are available. Thank you.
And Marjorie co-chairs the Children's Services Committee.
Good morning. Can you hear me?
We can.
Can you hear me? Oh, hi. Good morning. This is Maria Willis from the Legislative Committee. First of all, I want to apologize for the last meeting. We were having some issues with our login information, but our next meeting will be Wednesday, March 13th at 11 a.m. Wednesday, March 13th at 11 a.m. At that time, we could probably also discuss what happened at the legislative breakfast, which is scheduled for Friday, March 1st. Thank you.
Thank you, Maria.
You're welcome.
And I'm not sure if they're on, but on March 21st will be the Transition Services Committee. And the information is on our website, bkddcouncil.org, on the calendar. All of our meetings are posted on there with Zoom or Ring Central links if anyone is interested. All right. Next on the agenda, Brooklyn Family Support Updates. Debbie?
Thank you, Brian. Good morning, everyone. First, want to apologize to everyone. You're right. The Brooklyn Family Support Advisory Council website is down. It is in major reconstruction. We apologize. We want to thank the Brooklyn DD Council for picking it up for us. As soon as we have everything fixed and set up, we will let everybody know. Now, we did actually meet for the first time in a long time in person. We were at the Brooklyn Public Library. We were at Grand Army Plaza, and we met in the Information Common Lab. And what we were discussing is the new IBX, that's the light rail. We had Nick Rollison from the MTA gave a major explanation of how it's going to go from Bay Ridge all the way up to Jackson Heights, Queens. It's being built right now. They're doing major updates for everyone. Brooklyn, we invited them so they can do the Brooklyn update, and it went very well. We are going across the borough with all different libraries for our resource fair. The next one will be on Friday, March 8th at Grand Army Plaza Library. We are actually full for having vendors sitting at tables, but every agency is welcome to bring their information and they can leave it because, as you should know, the Brooklyn Public Library has 60 branches and all your information is spread through all of Brooklyn, and it gets out to a major amount of networks that you don't even realize will be attached, and they give the info. Two other things I need to mention. One, that tomorrow at 9 a.m. on Zoom, there will be through the MTA, and it is on the chat. Thank you, Mike. Thank you, Brian, about the explanation of what the congesting price means and how it will affect the disability community. What unfortunately the press and a lot of people have not been mentioning is that people with disabilities who are, and when our vans that transport our individuals, they will be exempt because they're taking and doing for people with disabilities, or if you want to say the word handicap. But you can go there tomorrow and everything will be answered. Now, there are hearings coming up. This Thursday hearing is actually full, but the next hearings will be, and they will be on the Brooklyn DD Council's website or the MTA, the Friday and a few next week. You also can send your information to the MTA. And as I said, I can give you the dates of the other hearings. There will be Friday, March 1st at 10 a.m. And you can go online to register. The same for Monday, March 4th, 10 a.m. And then Monday, March 4th in the evening at 6 p.m. They will be held at 2 Broadway, or you can also register to go online. Also, we'd like to announce that Christopher Greif in the ACTA committee has been asked to be he's now going to be the outreach chairperson. If I said his title wrong, well, it's all right. But he will be on, he's going around making sure that more elevators are being installed and opened, and to make sure that true accessibility is around all the train, whether it's the Metro North, Long Island Railroad, or the buses and trains. So that's why he's there right now with the committee reports for the MTA. So we're hoping everyone will be there, and we will let you know when we're having our next meeting in person. Again, I thank everybody, and everybody have a great day. Thanks.
Thank you, Debbie. All right, if no one has any questions for Debbie, then we can move on to general announcements. Floor is open if anyone wants to make announcements for program openings, special events. Go ahead, Doris.
Hi, my name is Doris Kahn, and I'm the outreach coordinator for New York State Institute on Disability. We're a family support agency, and we provide the following services. We have evaluations for non-Medicaid individuals who are seeking OPWDD eligibility, and they reside in Brooklyn, Bronx, Queens, and Staten Island. For more information, you can contact Elizabeth Sunshine at 917-699-0578, or you can email Liz at esunshine@nicidinc.org. NYCID also has funding for reimbursement for individuals who reside in the 5 boroughs. That's for camp, goods, and services. And the camp is around the corner. So if you would like to send your kid to camp and want reimbursement for it, contact Jackie Tripodi at 929-202-1115, or you can email her at jtripodi@nicidinc.org. NYCID also provides crisis management services for individuals who have OPWD eligibility and they reside at home in Brooklyn, Queens, and Bronx. Contact Juliet Hawkins at 917-524-4856, or you could email Juliet at jhawkins@nicidinc.org. We also have tickets for outings for individuals residing in Brooklyn, Bronx, Queens, and Staten Island. We do not provide these recreational outings to individuals who have self-direction services or reside in Manhattan. For more information, you can contact Sarah Alton at 718-494-6457 or email Sarah at salton@nicidinc.org for more information. We also provide transportation services for individuals who live in Brooklyn, Bronx, and Staten Island for medical appointments and or recreational activities. Okay, these services are not available to individuals who have self-direction or reside in Manhattan. Contact John O'Grady, our transportation coordinator, at 917-747-9424 or email him at jogrady@nicidinc.org. Brian, I put the phone numbers and the name and our services in the chat for anyone who wants. Thank you.
Thank you, Doris. Paula?
Hi, it's Paula Martinez Boone, your lawyers for the public interest. In general, we provide free legal services to individuals with disabilities in different areas. The best way to get our services is to call our office or to go online and see what we have done in the past. And perhaps if you have any questions, we do have a live intake receptionist that may be able to help you. However, and right now I'm announcing our Know Your Rights training upcoming special education regarding special education, March 12th English, March 14 Spanish, and the links are in the chat already. Please take it from there and send it out. Once again, this is a free training. It's going to be on Zoom, and we, do a training and we answer a lot of questions. Thank you.
Thank you, Paula. Debbie?
Thank you. I forgot to mention that next Wednesday from 11 to 3 will be the statewide Family Support Service Advisory Council meeting. I hope any people will be watching and virtually to attend, because at approximately 2:30 the public can speak. But we want you to watch because we're going to be discussing issues in reference to the ADM for reimbursement and how important family support services are. So we're hoping everybody will also be there to attend. So thank you. Okay, that's it. Thanks.
Thank you. Lataria?
Good morning. Can you guys hear me? I'm not sure. I'm calling in from the phone.
We can.
Great. Thank you. I put all the information for the Brooklyn Queens Intensive Parent Training Program, as well as SIP Shops. That's the program in support of siblings who have a sister or brother who have IDDD. The once a month program. That information is also in the chat, as well as AHRC is offering free evaluations for those who don't have Medicaid. That information is in the chat as well. Thank you.
Thank you. And for everyone, just to be aware, Natalia will be doing a bigger presentation at our March meeting on the Intensive Parent Training Program.
Thank you.
Thank you. Marion, I thought I saw your hand up. It went down.
I put my question in the chat. It was for Doris at NYCID, and I asked whether individuals that reside in a certified residence are eligible for. Okay, you didn't mention that, or I missed it.
It's individuals who reside at home.
Okay.
Right.
Okay.
Yeah.
Just checking.
Sure.
Thank you.
And I don't see any other hands.
Can you hear me? Hello?
Oh, yes. Okay, go ahead.
Oh, hi, this is Maria. Announcement. CP Unlimited is having a winter day have an Article 16 open houses. For Brooklyn is on February 28th from 10:30 to 2 p.m. at 921 East New York Avenue. And basically it's for comprehensive therapies, classes, activities, unique gardening program, and caring support for adults with IDD. There's also on the same day, February 28th, an open house in the Bronx at West Farm Center, and also in Staten Island, March 5th, from 4 to 6 p.m. I will send the flyer to Brian so he could post it. Thank you.
Thank you, Maria.
You're welcome. Thank you.
I don't see any other announcements. I do just want to ask, oh, Pat, go ahead.
Good morning, everyone. Pat Liu, Family Support Coordinator from GHO. I would like to announce that our Day Have Without Wall and Job Training Program, we have openings. We have a staff can speak Chinese or Korean. And for our family support service, we also have a case management service. This service doesn't require Medicaid, and we are assisting families who are new to the system, can assist them with their eligibility evaluation and get into the long-term CCO, care management service. So, and then anyone who are interested, would like to refer can contact me. Again, my name is Pat Liu. My phone number is 718-307-6563. Also, I would like to announce that we have a contract with CDNY. We can assist family who speak in Korean or Chinese with their enrollment. So we have a contact person for someone speak in Korean. We have 718-307-6570. Or family speak in Chinese can contact 718-307-6564. Thank you.
Thank you, Pat.
Brian, I have a quick question to some of the.
I had a question for you. So go ahead.
So I have a question to the agencies that we're talking about the service access that are able to help individuals. I wonder if you guys are able to help individuals that are in the shelter. If they're already OPWDD eligible, are you able to go there to support them in terms of evaluation? Maybe Doris and Pat, I don't know. Just and I believe
that question was already asked, and yes, we can.
Wonderful.
I
you can
asked,
actually go to the center to the shelter.
that I asked that, and from my agency, and they said they can. It was asked before.
Okay.
And they can.
Wonderful.
I guess it's a case-by-case basis also. So, but as far as, I think you're asking more like if our grant for evaluations allows us to do that. Yes, it does. We checked into that. That's what I mean. But logistically, it's a case-by-case basis, but they can do it.
So we will reach out to you, or we will reach out to
No, you
Julia?
reach out to Elizabeth Sunshine
Elizabeth.
for evaluations, correct. I put her number in the chat.
All right.
And yeah, okay.
Wonderful, thank you.
If it changes, I'll let everybody know.
Okay, and Lucy, I had a question for you. You put in the chat that effective January 25th, the SARF, as it's been come to be known, has transitioned to an electronic version. My question is, so the CCOs have been trained on that. I don't, coming from the agency side, I didn't know that went into effect as a provider. So what, can you just briefly talk about what changes that we'll have for providers?
So the service amendment request form is used for individuals that already, waiver enrolled, they have services in place. If they want to make changes to the services that they're receiving, they will submit a service amendment request. They used to submit a service amendment request form, and typically the care managers will be the one to do it. However, as I said, effective 1/25, we're no longer using a paper version of that form. We're using an electronic version. And that means, the CCO will go into choices and they will fill out the form and they will submit it to us. So on the provider side, it just means that, if if say an individual is changing from a one day program to like a different day program, they need to connect with that person, with the individual CCO, and the CCO will submit the request. So for the most part, I don't think the providers have anything to do with this process. We do get a lot of questions and requests from providers, sometimes telling us that they have individuals that are waiting to attend their programs. Really is a conflict. Those type of requests should really be coming from the CCOs. So the CCOs are the ones that are, submitting the form. They're the one following up. They're the one, making sure that those things are in place. And for the most part, providers really shouldn't have, any process with that. Unless if somebody wants to leave a program A and go to program B, the providers will have to disenroll them from their program so that they can enroll in program B. I don't know if that helps.
So I guess the reason I bring it up from the provider perspective, I feel like with it going electronic, there runs the risk that the providers get left out of the communication of the process. Because in the past, when the SARFs were filled out manually, it would be emailed to us as a provider to review, make sure everything was correct, make sure we actually had the space for the person. And now I feel like if things are done electronically and going through choices, some providers may be left out of the process. And then all of a sudden you turn around, you find out a new person's coming to your program and you weren't included in that process and aware of what was happening.
So I kind of think
just some feedback to bring with that's why I bring it up.
Yeah. Thank you. So that's something that we, I think the CCOs need to be a part of that type of conversation, because they are the one, we give the authorization, and the CCOs will be the one to kind of look for the programs that will be able to provide the services to the individual. So they should be making sure that there's a vacancy or that they have a provider that can serve the individual, so it's a larger conversation that we need to include the CCOs. I mean,
yeah, because the other issue, and then I know we have a hand up and I'll get to Trudy. The other issue I worry about is because as a provider, we can't see anything in choices and that until that person is enrolled with the provider. So we wouldn't even know necessarily that something's in process happening at our agency until the approval took place, until the enrollment happened.
Okay, until the enrollments happen.
So like if you tell me John Jones is coming to my program, I can't see anything being done in choices until they're enrolled in my program. And then John Jones opens up to me in choices.
But remember that you are the one who is going to submit a DDP-1 to enroll John Jones into your program.
Yeah, but if the SARF is already approved for my program, that comes before the DDP-1, doesn't it?
No, so it kind of, you have two ways of doing it. We can approve a program. We can change, the care managers can come to us and tell us that, somebody wants to change from, I guess, DAHAB and go to SAMP. We will approve that service. And then the care manager will look for providers. It can be done, we do the approval, they look for a program that will provide the services. And they can also come to us and say that, John Jay wants to go from agency A to agency B. When that happens, we're assuming that the care manager has already discussed with the family as well as with the individual that agency B is interested in providing services to John Jay. So those are the type of scenarios. And I mean, I didn't go into details about the SART, but the part of that process is that, eventually, once we approve a SART, we keep a record, the OPWDD will have in our system everything that John Jay is approved for. So that the next time that, care manager comes to us to request any kind of change about John Jay, we will have all the services that John Jay is enrolled in and the amount of authorization that John Jay is already enrolled in. And those things will auto-populate. So moving forward, as we continue with this process, we're going to have like a record with the regional office Because previously we found that a lot of care managers don't even know the services that, you know, individuals are approved for. And they come back to us again and they want another approval, whereas we already have it that this person is approved for this service. So the first time we get that request, we're going to return it to the care manager to make sure that they indicate all the services that John Jay is approved for, so that the next time it comes, it will automatically auto-populate and we will have it in our system. So going, you know, as we move forward, you know, we will have a record and we can keep data. We will know about what's happening and the changes, and we will be able to kind of, you know, have that record, you know, even if the care manager changes, even if other things happen, it will be in our system. So that's part of the reason that, you know, this process was put in place.
Okay, no, that sounds good. I just wanted to make sure it's still going to include all parties. So thank you.
Yeah, sure.
Trudy, go ahead.
Yeah, I just wanted to piggyback what Lucy was saying. I'm speaking from a care management perspective. It is the responsibility of the CCO, the care manager, to include the provider. And in my experience, I always wait specifically for the provider to tell me, for example, the units, because not many, for example, individuals attend, you know, every day program, they day 3 days or 4 days. So they have to really tell me specifically the units of that day program if they want to change to another day program. And I think the electronic SARD, it becomes a little bit easier for us because the paper trail and emailing OPWDD, the scanned paper and waiting, it was a lot. But now I think it's going to be more seamless as long as the CCO and the care manager makes in touch with the provider. And most of the providers have to provide information to the care manager as to what changes so it can take effect on electronically and OPWDD can authorize it.
All right, thank you. Angela, you have your hand up.
I do indeed. Good morning. Good morning. My name is Angela Blades. I'm the Family Support Coordinator for Brooklyn DDRO. And I just wanted to remind people that I'm still here. You can send me any questions you have regarding reimbursement, or if you need assistance with anything else, at angela.blades@opwdd.ny.gov. If you need to send me if you would like to call me, you could do that also. I'm trying to remember my number. What is my number? 718-264-3928. Again, that's 718-264-3928. We have updated the guide, as Ms. Grice mentioned. Right now, they're not able to provide it, but if you need it from me, I can always send it to you. It's been updated, so as far as we can update right now. If you have any other questions, you can call me or email me. Thank you for your time and have a good day.
Thank you, Angela. So the guide is also on the Brooklyn Council website, and I am typing all of her phone number and the email that she just provided in the chat, so anyone that needs it.
Yeah, I had put it in a little earlier, but I just wanted to remind. Thank you.
Thank you. Any other final announcements before we end?
I do. Can you hear me?
Yes.
Oh, okay. Brian was so kind to post this in the chat since I'm on the phone, but just wanted to announce that CP Unlimited is having wheelchair clinics in all boroughs. It's complimentary cleaning, sanitizing, and repair services for wheelchair for individuals with IDD, for veterans, seniors, and others. Everyone is encouraged to RSVP. We do have transportation available on the following dates: March 23rd in Staten Island, April 20th in Brooklyn, May 18th in the Bronx, June 8th in Queens, July 13th in Hudson Valley, July 20th in Staten Island, August 10th in Brooklyn, and August 17th in the Bronx. To reserve a day and time, please email Esther Gerald at cpofnys.org. All the information is in the chat with addresses. Thank you.
Thank you, Maria.
Thank you, Brian.
I don't see any other hands, so I will remind everyone again, this Friday is the 5-borough virtual legislative breakfast. Please make sure you register, and also make sure when you go to log in, you're logging in on the email you registered with. That will make it a much smoother process. The event starts at 10 a.m. and should run until about 12, maybe a few minutes over based on years past. But it should be a great event. A lot of advocacy towards funding for our field, the DSPs, bring awareness to some of the current issues. I know we'll have a number of elected officials and or their representatives present on the call, so make sure you attend that event. And I think I've posted the flyer enough in the chat, so you should be able to find it probably 3 or 4 times. Rochelle, go ahead.
And just one more thing on the advocacy side, which is that we expect the legislative one house budgets to come out in mid-March. And it's really important now for everybody to contact their own state assembly and state senator to advocate that our issues get included in their one house budget. Because if it's not in the one house budget, it's game over. So this is the time to really step up the advocacy. And if anybody has connections to Speaker Hasty's office or to, oh boy, the leader of the Senate, I don't know, then please use those contacts.
Is it State Senator Cousins?
Yeah, Andrea Stewart Cousins. Thanks, Debbie. I had a senior moment. So if
I forgot her first name, but I got the list.
Yeah, Andrea Stewart Cousins. So if anybody has those connections, please keep your eyes peeled for One Clicks and any other advocacy events that will be coming up, because I'm sure there will be more. Thanks so much.
Before we end, I also want to thank David Schaefer is on behalf of Senator Prasad's office. He joins most of our meetings. We appreciate the senator's support. So thank you, David, for joining. And I know you'll be joining with us on Friday as well. So thank you for that.
Of course. Thanks.
All right. If no one has any other final announcements, wish everyone a great week. Hope to see everyone on Friday. And thank you all for attending.
Thank you, Brian.
Take care.
Thank you.
Bye. Have a good day, everyone.
Thank you.